recording. I hope everybody's okay with that because I want to make sure that we have this information for posterity. Not everybody can be with us. I'm going to go back to our agenda, and can everybody see the agenda in front of us? Cool. Thank you. So just real quick, our agenda today is we're going to have a presentation from Gabby Boyle from the STA Care Center and Marty Scott with Live Well Douglas County. And they're going to be talking about, they're going to be presenting the Douglas County Sexual Violence and Prevention Plan. There's a good amount of folks that have been engaged in this plan, but I think there's folks that haven't. And so the intent for today is to give everybody an opportunity to have awareness and understanding, and then do have some conversation around this plan and what's possible. What opportunities are we missing, where there's some connections that we can make to some existing work, and how do we just take this work, the efforts of the prevention group and expand on it and perhaps accelerate some of it and have impact for the folks that it's aimed to serve. So with that, the rest, after we have that presentation from Gabby and Marty, we're going to move folks into some breakout groups. If they're, we're going to ask that in those breakout groups that they're going to be randomly, we're going to ask for folks to select which group they want to sign up for. Group 1 will be, the 1 through 4 will be based on the what's listed on the agenda. So you have foster safe neighborhoods, affordable housing, reduce alcohol use and outlets, and then reduce gender pay equity. So 1, 2, 3, and 4, think about which one you you decide to sign up for and self-select. We are going to ask that once you're in your breakout groups, you decide, we're all friends here in this community, right? We know each other. Find a volunteer to serve as your facilitator / timekeeper, and then a note taker that's going to use the Google Sheet that was created and is hyperlinked in this in the agenda. And I'll drop that in the chat as well to make it easier for folks to access. We're going to ask that you take notes there so we can bring that back to the group to debrief and report out at 1:50. And then we're going to just spend a little time doing that report out, and then have some time left for announcements and agency updates before we excuse folks. And yeah, sound doable? Cool. All right. Well, with that, Gabby and Marty, the floor is yours, and screen share should be open, and let's go.
Awesome. Thank you, Jill. I'm going to start sharing my screen, and I'm going to announce it because that's just what we do in virtual meetings. I'm really excited to have the opportunity to have this conversation with you all. As Jill mentioned, I know that a lot of you may be familiar with some of the work that we're doing, but I also get the sense that there are people who are missing from this conversation that I really want to integrate into the work of the SVP work group. So my name is Gabby Boyle. My pronouns are they, them. I'm the prevention specialist at the Care Center, and I'm going to let Marty, my co-chair and co-facilitator, introduce herself. Marty, I think you're on mute.
Good afternoon. It's a pleasure to be here. My name's Marty Scott, and I'm the Executive Director for Live Well Douglas County.
Awesome. So I want to start the conversation today by kind of giving you all, maybe some of you who aren't super familiar with the field of sexual violence response and prevention, just a little bit of context to kind of help better contextualize the work that we're doing. So it starts with a very brief and hopefully insightful history of the Care Center. We've been around for about 50 years. We were founded in the 70s, and in classic 70s fashion, it was a really grassroots community-based advocacy effort that was launched by a group of women in the community who were responding to conversations happening on campus about sexual assault. Again, very grassroots, just folks answering, on their rotary phone hotline calls from their house. Since then, we have expanded and grown not only our services, but also our mission. So we are dedicated not only to providing crisis response services, but also to supporting people who are affected by sexual assault throughout their healing journey, throughout their process, as well as promoting a culture of consent through education and prevention efforts. We serve folks of all ages and genders. We really try to make our services as low barrier and inclusive and flexible as possible. So that includes our advocacy and response program, which still has a 24/7 hotline. Now we just have cell phones instead of rotary phones. We also will work with survivors if they're moving through systems like the criminal justice system, healthcare systems, etc. We have 3 therapists on staff that are amazing. They see folks through all stages of life at all points, again, kind of in that healing journey. And then we also do education in the community at large. We have an amazing youth educator who does education K through 12 with students, starting with conversations about safe touching, having more complex conversations with middle and high schoolers about consent and sexual violence. We also do professional trainings with other nonprofit organizations. So if that's something you're interested in, let me know. And we really try to get everybody on the same page about preventing sexual violence, envisioning a community where people can live free of a fear of violence, where they don't have to accept it, where it's not normalized. And this field of prevention, of kind of community-based prevention, is relatively new. So when the sexual violence response field was first created, it was really purely crisis response. And then when prevention started entering the conversation, a lot of it was based on individual responsibility. These kind of risk reductive defensive strategies that kind of promote an idea that this is something that is just going to happen, and that all that a community can do is kind of arm individuals with tools to defend themselves from it. So that's where we see things like self-defense courses, promotion of systems like the buddy system, etc. All of those things can be really empowering to individuals, and I certainly do not want to, poo-poo those efforts completely. However, where really somebody could use all the risk reductive techniques in the book and still experience sexual violence. And that's when the field sort of started to pivot to this idea of it being a community-based problem with community-based solutions. And that's kind of where the work of the sexual violence prevention work group is located, is really looking at those community and systems levels changes that we can make to promote factors that are protective against violence and reduce factors that increase somebody's vulnerability to violence. So we're really taking a super upstream, like, public health approach. Just as a quick history of the work group, we formally convened in 2018. We ran a community needs assessment in 2019 to kind of identify and inform our strategic plan in terms of what factors in our community were the most prevalent. And then we started our strategic planning and implementation process in 2020, which is ongoing. The work group is a part of Live Well Douglas County. And I'm going to pass it over to Marty, who's the executive director of Live Well, and again, the co-chair, to kind of explain how our mission connects to Live Well at large.
Thank you, Gabby. Well, Live Well has historically focused on healthy eating, active living, tobacco-free living. And as time has marched on, we really understand that health outcomes are influenced not just by our health behaviors or the services or care we might get from a doctor, but over 50% of our health is influenced by our community, the way it's set up, the systems that are in place, the policies in place that all impact our social and economic and physical environment. And so in lots of ways, everything that the work groups are doing, supporting healthy eating, active living, tobacco-free living, is being addressed in the very same way that Gabby just shared in terms of the prevention of sexual violence. So the SVP work group just works really well under and with Live Well Douglas County. And that's pretty much the connection there, is that we're both groups, all of us are still addressing systems and environmental changes to support healthy behaviors and healthy outcomes and violence prevention.
Thanks, Marty. You said it perfectly. Kind of like Marty said, you know, we really try to be interdisciplinary, working with solutions that maybe seem out of the box, working with people who are not just siloed in the field of violence prevention, but folks in public health, folks in housing, folks in economic development. And our solutions, because of the strength of our partners, really are kind of cross-cutting. We are looking super upstream, again, not crisis response oriented, although the care center does have plenty of crisis response services if that is needed by a community member. The work group is really focused on upstream solutions, and we really try to be intersectional and inclusive. You know, it's the sexual violence field, the anti-violence field historically has left certain people out of conversations, has created solutions that have maybe disproportionately, you know, affected folks who are marginalized. And we're trying to be aware of that, acknowledge that history, and create strategies and solutions for a community that are equitable, that address the disproportionate risk that certain community members have to experience violence. Yeah, that's sort of our guiding principles. So we're answering this question: why does sexual violence occur and what can be done to prevent it from happening? We know that violence takes many forms, that people experience violence in many different ways, and that oftentimes all of the forms of violence are connected to one another and share the same root causes. And these root causes are kind of housed under the umbrella of oppression. You know, the causes of violence are things like racism, are things like sexism, misogyny, ableism, transphobia, homophobia. These kind of systems of oppression create both individual and interpersonal violence, but they can also create, kind of like Marty said, systemic, cultural, environmental violence. So people who are more likely to experience discrimination on the basis of gender, race, sexuality are more likely to experience sexual violence. Folks who are disproportionately experiencing poverty or experiencing houselessness, who are experiencing disadvantages in the healthcare system are more likely to experience sexual violence. So because of all of those overlapping causes and because of all of those connections, we really have to step back and look at the big picture to understand how we can kind of not only prevent sexual violence, but create healthier, better outcomes for everybody in our community. Again, taking this approach is shifting the blame away from an individual, away from, you know, a survivor of an event, and really kind of giving a call to action to the community to respond and to look for solutions to what is really, again, a systems-based problem. The grant that funds the work of the work group does specify that we are only allowed to work in primary prevention, which ideally means that the care center can work itself out of a job. You know, if we're preventing violence before it has the chance to happen, we're kind of freeing up a lot of resources for folks to feel more connected and more safe in a community. Does anybody have any questions about any of this? I know it's kind of like an intense just nosedive into a field that you might not be super familiar with. And I want to just give a moment for folks to digest and ask questions if they have them now. All right. Well, if you think of anything, let me know. I'm going to move on now to talking specifically about the strategies that the sexual violence prevention work group is working on, and kind of how those strategies came to be. We've got 4 focus areas, as you saw on the agenda: safe housing, or fostering safe neighborhoods, affordable housing, reducing alcohol outlet density or alcohol use, and then reducing gender pay inequity. So our first focus area, fostering safe neighborhoods. The reason that this was identified as a focus area is because it is identified by public health organizations as a risk factor for sexual violence. So organizations like the CDC, other sexual violence organizations that are much larger, have been gathering data to create kind of some evidential links between environmental factors and between high rates of sexual violence. In neighborhoods where there's low cohesion or where people do not feel supported, where people do not trust each other, residents are more likely to experience sexual violence. And in Douglas County, when we ran that needs assessment, over 50% of the community rated their neighborhood cohesion as low or medium, and 1 in 4 residents reported that their housing was fair or poor. So what that says to me is people do not have access to quality housing that meets their needs, and they do not feel supported in their neighborhood. So to respond to this, we've convened a community by design subcommittee, which is a subcommittee that is kind of taking a look at environmental design decisions and changes that can be made to encourage connectedness, accessibility, and safety. Initially, this community by design subcommittee was working with a tool called Crime Prevention Through Environmental Design, or Sept, which is a set of environmental design principles that prevent crime in the name. But we sort of moved away and modified some of those principles because our goal is not to prevent crime, our goal is to prevent violence. And so some of the Sept principles did not necessarily align with our mission or with the needs of the community. So we've created our own little blend of environmental design principles called community by design. Things like, do I know where to go? Do I feel comfortable using the public spaces in my neighborhood? Is there a sense of community? Is there visibility? Like, can I get around my neighborhood without having to worry about tripping on something or slipping on ice, etc. And we've created a toolkit for residents to assess different factors in their neighborhood and then access resources to kind of help mitigate some of those factors that might be contributing to a lack of cohesion. For total transparency, this focus area was really affected by COVID. We initially had a launch project planned in 2020 in the Brook Creek neighborhood where our partners, Tenants to Homeowners and Habitat for Humanity were doing some work. But when we tried to run a more targeted survey in that neighborhood to kind of figure out how to best move forward with this project, we didn't get a lot of responses. And it felt like, in the midst of COVID, the neighborhood and our partners and ourselves didn't really have the capacity to launch this. So in 2021, we're kind of revisiting the strategy, thinking about ways that we can, use that toolkit, use these principles to bolster either ongoing community efforts, things like, trail making, things like building safer sidewalk routes or community gardens, community centers, or again, to identify another target neighborhood to kind of work with in launching this. Our next focus area is affordable housing. This is probably our most active and dynamic focus area. Housing is connected to sexual violence because diminished economic opportunities across the board contribute to a person's likelihood of experiencing sexual violence. And housing cost burden, having a high housing cost burden, is going to contribute to somebody's economic opportunities. If somebody is not able to relocate, they may be forced to stay in an unsafe situation. And in studies that have looked at policies that promote like housing mobility, so the ability for a person to kind of choose a neighborhood that they feel suits their needs, there's better outcomes in things like employment, education, satisfaction, safety. Those all affect sexual violence too. And then finally, folks who are experiencing houselessness are more likely to experience sexual violence, and people who experience sexual violence are more likely to experience houselessness. So there's kind of a cycle there as well. In Douglas County, 56% of renters are cost burdened. That's specific to Lawrence based on the housing study that Lawrence commissioned. and 25% are severely cost burdened, meaning they spend over 50% of their income on rent. There are also not a lot of affordable options for folks who are seeking to purchase a home. So what we're doing in this focus area is we have convened a housing subcommittee, which is a really wonderful and active kind of group of housing service providers, including folks from the Housing Authority, the Community Shelter, Tenants to Homeowners, Family Promise, Habitat, and more, who are just really assessing kind of what needs of the community are not being met, kind of sharing resources, sharing strategies. We've supported the dissemination of community housing resources, particularly with COVID. There's been a lot of funding coming down for folks for things like rental assistance, and we've tried to get folks connected to those. And then we've also done a lot of work researching and advocating for the development of city ordinances that are protective of affordable housing, that kind of create long-term solutions to housing availability, to ease of access of housing. And this is based on conversations that we had in those subcommittees. In particular, something that is a huge problem right now is there's a lack of voucher acceptance amongst landlords. Landlords are also not necessarily working with tenants receiving rental assistance. And we're seeing other tenant screening measures that are leading to a lack of access of housing to things like folks being screened out for low credit scores or what's perceived to be a low credit score, eviction histories, criminal histories, etc. So we're really looking at what other communities have done to address similar problems and what we could do at a policy level to address those problems as well. Our next focus area is reducing alcohol outlet density and use. We know that in communities where there's higher alcohol consumption and behaviors like binge drinking, there are higher exposures to sexual violence. I want to make it clear that we do not take the position that alcohol causes sexual violence, but rather recognize that it creates an opportunity to make somebody vulnerable, to incapacitate them, and again, is connected to other types of community violence as well. In Douglas County, we have a higher rate of binge drinking than the rest of the state. And Lawrence in particular has a very high alcohol outlet density. So that means the volume and proximity of places like bars, liquor stores, where you can get alcohol. In this focus area, we have supported the development and implementation of a city ordinance that makes it mandatory for establishments applying for or renewing a liquor license to go through sexual violence and bystander intervention training. Those trainings, honestly, I'm always really surprised at how dynamic the conversation is. It's a great opportunity to get a bunch of leaders in the service industry in the same room and have them brainstorm solutions to community safety together. So far, we've trained about 40 individual establishments since we started doing those trainings last October, and we've reached about 100 individual managers. We also are continuing to operate and continuing to strengthen our Safe Bar Alliance program, which is a voluntary all-staff training for establishments that are really committed to, thinking about community safety, thinking about the safety of their patrons and staff, particular to sexual violence. These trainings are, to be honest, a lot more engaging than the city ordinance trainings. They're really targeted. They're really a facilitated conversation, again, where we're encouraging staff to identify bystander intervention-based solutions and policy-based solutions to sexual violence in their establishments. And then we're supporting an existing emerging community effort surrounding alcohol use, which we would love to see if you identify any of these in the conversation later. For instance, there's some partnerships with sorority and fraternity life on campus, potential partnerships with non-traditional venues like music venues or event venues that we're looking at creating a targeted program for. So again, really trying to bolster kind of ongoing community conversations. And then our last focus area is reducing gender pay inequity. As I mentioned earlier, poverty, disparate economic opportunities are directly linked to an increased risk for sexual violence. economic security of families, of individuals, depends on a community's ability to have those individuals participating fully and equitably in the workforce. So this means things like employment opportunities, things like, who has access to workplaces that are safe, that are equitable, who has access to workplaces that promote a living wage, and Douglas County, there is a higher number of women experiencing poverty than men. And this strategy in particular is really intersectional because we know that pay inequity, labor inequity do not only affect people of different genders, but also are really significantly impacted by disparities in race as well. So in Douglas County, our Black neighbors have a much higher rate of experiencing poverty, and our Hispanic and Latinx population experiences unemployment at significantly higher rates as well. And we see this with Indigenous community members as well. These are just a couple of statistics I pulled from their work that the Anti-Poverty Group has put together. So recognizing that there's already an ongoing community conversation about this, we've kind of joined forces with the Anti-Poverty Plan and are helping convene and kind of contribute to the work happening in the jobs focus area, specifically around things like employment discrimination, whether or not it's being reported, specifically around things like, again, looking at what jobs are paying more equitably, what types of working conditions are safer, what community members are disproportionately affected by those factors. And that work has just started. So again, super eager to hear what you all have to say and connect with folks who want to be at that table. So as you all have probably noticed, there is a lot of cohesion, synergy, parallel movement happening with other community efforts in the sexual violence prevention work group. We really want to strengthen those ongoing efforts. We don't want to be siloed in our conversation. We want to create that collective impact, bolster what's already being done by community members. So these are a couple of other work groups, other coalitions that we've started to partner with. But again, I'm very eager to hear what you all take from this and where you all identify other cross-cutting work that's happening. So that's us. That's kind of the end of my spiel. I'll drop my email in the chat as well if there's anything you want to share after this meeting, but thank you all so much for listening. Now I'm going to stop sharing my screen. Again, I have to announce it because, it's what you do. And pass it back over to Jill to get us set up in the breakout groups.
Thanks, Gabby, and thanks, Marty. Let's see, I'm going to real quick, I'm going to drop a link to, I'm going to drop a link in the chat to everybody for the Google Sheet, where we're going to ask folks to track their notes. And so if you haven't already looked at that, real quick, just to orient folks, real quick, just to see where do you see alignment with community plans or initiative, what's missing, and who should or should be involved, who should be involved that isn't. So there's one for each of the groups, and yeah, we'll ask that one member of the group open something up, and I already see some folks looking at it. Yeah, good. So I am going to attempt to open up the breakout rooms, and again, take a look at, if you have access to your agenda still. Real quick, I'm going to do a quick, just to reminder of what group you might want to be in. So 1 is foster safe neighborhoods, 2 is affordable housing, 3 is reduce alcohol use in outlets, and 4 is reduce gender pay equity, and reduce gender pay inequities. That's a typo on my part. Let's see. So think about that. Give me just 1 second. I'm going to stop sharing. Okay, I think everybody's back. I know some folks had to drop off. Ooh, I see some good final notes getting put in. Let's see. I'm going to do another fresh share screen. Let's see. I hope that you guys, everybody talked about who's going to report out. And let's just spend some time, whoever's going to report out. I'm doing a share screen now. You can talk through what your group talked about. And then we'll pause for any feedback from the group. So who had foster safe neighborhoods? Who wants to report out?
Well, I did the notes, but I didn't know that I was going to be reporting out.
Go for it, Bev. Come on.
So
Thank you, Bev.
I do think if Elizabeth feels up to it, if she wants to help with the part that she brought up a concern that I think is really valid for us to remember. So just quickly, the ones that we talked about is when it comes to fostering the safe neighborhoods, here's some plans under the first column. I know you can all read those of some other plans and initiatives that might be out there that would really align with looking at the environment and improvements or changes that could be made, things that we're missing, just the fact that questioning whether there's really any awareness for the public about these efforts and the explanation behind them, getting the neighborhood groups involved, because we felt like anytime you're going to ask somebody to change their living space, it's better to have buy-in from the community or the neighborhood. And then we talked about like activities and ideas about having events. We used to call them block parties. I don't know if that's probably an outdated term, but getting together with your neighbors and having a barbecue. I know I live in a different community, but we even had the city would give us $200 so you could have a block party and buy hot dogs, and you could block off the end of the block. And that was really just a great way to meet your neighbors, so that you know people, and when you need something, then you know who to go to and ask for help. And then those that should be involved that we thought maybe weren't involved are here in column 3. And we just listed some things that we were just brainstorming in groups. And I don't know if Elizabeth.
Yeah, I'm here.
If you feel comfortable sharing, does everybody know what this group was though about talking about like the environment? You know, it's down at the bottom if you need it, but you know, making sure neighborhoods you can get around, they're well lit, they're friendly, you know, they're not full of litter, that, you know, that kind of thing. So, but Elizabeth had a great point if she feels comfortable sharing.
Yeah. You know, I was just, when we were talking about partnerships with neighborhood associations and talking about standards of what is welcoming, you know, I think one really big concern is, you know, what actually statistically improves safety, and what is just the influence of white culture on what a neighborhood should look like, and those really white supremacist standards that I think would be really detrimental to influenced by when it comes to the standards of safety. And you know, when we were talking about the working with neighborhoods, you know, so many neighborhoods have been a big challenge in our community when it comes to making progress on issues pertaining to homelessness. And that has to do with those white cultural standards of what they want their neighborhood to look like. And so having those be participants in the work, but also know that they might be barriers to making progress. So that's just kind of some of the thoughts that I had. I know a lot of people would say that a lot more eloquently than I did. So.
Any reaction from folks? Megan dropped something really great in the chat about having the Uplift coffee truck is scheduled to come to their neighborhood every few months on a Saturday morning, and just putting out an invitation. These are great ideas. Any questions before we move on to the next group, or observations that folks want to throw out? Okay. Right. Group number 2 was affordable housing. Who would like to report out for this group?
Gabby, would you like to?
I feel like I was in it too much. Are you comfortable, Christina?
Sure.
Okay, great.
Yeah.
Thank you.
Okay. Absolutely. And please feel free to add in if I have any gaps. So in terms of potential alignment with other community plans, Danny brought up the CDBG 5-year consolidated plan, which is in process, and they're looking for alignment with other initiatives, and there might be some here. We talked about the Lawrence Community Shelters Housing First initiative. And then we also talked about the work that Adult Protective Services does in terms of getting calls that sometimes relate to housing. Sometimes landlord issues and folks need to move, need help with moving expenses, need to help get people to safer housing. So those were a few alignments. We talked about in terms of what's missing, that we need to get new development code approved for more affordable housing, looking at development building code and planning incentives that could be helpful for allowing more types of mixed housing development and also more types of creative housing. We also talked about the need for code enforcement and that there are some vacant units that are basically just sitting there, and a need to align incentives and speak to how we can meaningfully engage folks such as realtors and developers. In terms of who needs to be at the table, who might not be currently: developers, neighborhood associations, community members affected directly by the issues, faith communities, those who create supply for housing, LMH Health, mental health facilities that might be discharging people with no safe place to go, and again, Adult Protective Services. Anyone feel free to jump in with anything I missed.
I know that Rebecca also mentioned that the Chamber of Commerce has been talking about affordable housing, and that might be another alignment with other community plans or initiatives that we might think about. I know that there's going to be at least one representative at the landlord engagement meeting next week for the HSC, so that'll be an interesting conversation.
All right. Well, unless there's any other comments or observations before we move on. The next one is we're group number 3, breakout number 3, which is reduce alcohol use in outlets. I'm going to report out for this and let my colleagues that were in the group jump in. In terms of alignment with other community plans or initiatives, the bystander intervention training that's been going on, an existing effort. And one thing that I should have put in here that I failed to, and I know that our friends from DECA had some obligations today that they could not participate, but I know that the Douglas County prevention planning work that DECA is doing has a lot of overlaps here. And I know that folks with the work group have, made that connection as well. So I do think that our friends at DECA are highly aligned and supportive of making sure that we're having the highest amount of impact here as well. Some of the things that we did talk about in terms of what's missing is Greek, what is the partnership or relationship engagement with Greek housing, access to safe transportation, more information about causation, shifting cultural dynamics. We had a really great conversation that I think really was the heat was, we were turning up the heat on one another just as we had to idle down, but a lot of good information, I think, about what are the cultural dynamics that need to shift in the community to have impact in this area, and encourage healthy social activities. How do we look at things like the downtown plan? So maybe the downtown plan needs to go in this. I'm like talking myself into it. Downtown planning. How do you align with having social activities and social opportunities and amenities that do not require alcohol? Those are some of the things that we talked about there. And so that's culture, but that's also dynamic, it's institutional. And then who should be involved that isn't, again, downtown business owners. But I think, as we were just wrapping up the conversation, it's not just downtown, it's throughout the community. Where are the places and spaces that folks can go to have a good time, a really great time at hours of the day that people like to go out and have a good time that doesn't necessarily require alcohol and put folks at risk. So we had a really good conversation, and folks in our group, anything to tease out that I didn't say?
No, good job, Jill.
Cool. All
Well, I
right.
just wanted to reiterate what Leah had brought up, the discussion of who should be involved. I mean, Leah made the point that, many women are raised to be concerned about sexual violence, but maybe not enough men. So maybe we need to have more men involved in the conversation about this prevention work. So I just wanted to point that out.
Thanks for saying that, Rich. You're often like one of the few men in a room full of women. So I really value you, Rich. And thanks for teasing that out.
Gee, I really value you too.
I mean it.
I have
Okay.
an idea that just popped in my head in this regard, and it's maybe a little far-fetched, but I know my personal consumption of alcohol went down when I started exercising more regularly. And so I don't know if there's a space where encouraging that type of, it's real hard to get up and go running when you're hungover. I mean, it is what it is.
Yeah.
But that physical health being more front of mind would potentially have some positive impacts in other ways. It popped in my mind when you were talking about the other really fun places to go do things, because sometimes the alternatives help to, reduce. So I don't know. Gyms, I don't know.
Bowling. I love bowling. Although I do drink beer when I go bowling, if I'm being honest, but not when I go with my kids. Okay. Let's move on to our last group, and that is gender pay inequity. Who would like to report out here, friends?
Hi, that's me. So we talked about a number of things. We just kind of had an open dialogue about a number of things related to gender pay inequity. We started with talking about how we have a standard of fair employment practices, but we're not required to follow that standard, and how can they actually be utilized? How can they actually be enforced? Let's see. We also talked about, I work for Lawrence Public Library. I'm the diversity and equity coordinator there. And we had asked the question, how can we get data on how people compare in compensation? And Lawrence Public Library happens to be doing a compensation study right now. So we talked about the idea of doing a compensation study where you specifically tease out data on gender, on gender, on race, et cetera. And then we also talked about hiring practices and how they affect inequity, gender inequity in pay. So I talked about how a lot of people hire folks within a certain network, that network of people who their employees know and who they know, and that tends to breed the same person over and over again. You end up with the same candidate over and over again, and this is one way that we can combat the gender pay inequity by also making sure that we branch out our networks, and being intentional about that and looking for people who aren't in your current network and finding different ways to hire, being more creative on getting your job application in front of people. Let's see. Oh, the survey tool. Would anybody like to speak on I understand that so somebody talked about a survey tool for how family friendly an employer is.
That was me, Frankie, and
yes,
that was,
thank you.
yeah, it's specifically related to family-friendly workplace practices. So, but it does get to some of the aspects that impact gender inequity in employment, and that's from the Wichita State University is doing that in conjunction with the Kansas Children's Service League to help employers gauge their own, the extent to which their own employees feel they have family-friendly workplace practices.
I see that Rich is talking about the social division of labor, and I was actually about to talk about, we both talked about, well, Kim brought up the fact that a lot of women are forced to leave the workplace. Like, for instance, in the pandemic, if somebody did have to leave the workplace and take care of children, more likely than not, that person was a woman. And Rich is talking about that social division of labor. And I think that definitely comes into that and how that relates to the, inequity of pay over a lifetime. And also we talked about the socialization of people who are assigned female at birth in general, and how generally people who identify as female are socialized in a way to not ask for more, to not, not push buttons. And we are generally less likely to ask for higher wages when we're getting hired. We're less likely to apply to jobs that we feel that we're underqualified for. And, how do we deal with the social aspect of the inequity in pay was a question that we brought up. Yeah. And if anybody else has anything to add, please chime in.
I want to say, just not necessarily just people who are assigned female at birth, but like women, queer people, people of color who are having their voices not represented in a conversation. Yeah,
I definitely agree. I'm trying to decide, how narrow do I want to be when it comes to, are we talking about gender inequity? Are we talking about, because we can talk about inequity of pay across many marginalized identities.
Thank you, Frankie. Thank you. I would just say real quick that this group on pay inequity, Gabby made the connection to the community health plan, the anti-poverty community health plan, the jobs piece of that. That group has been in the anti-poverty plan, the slowest moving one, but I'm okay with that because we've been doing it in a way that has been, we'll update you all at the quarterly meeting, but we're still trying to suss out like who is ready to lead in these on the jobs piece of that, where we really seen some compelling overlap and intersections with other plans and initiatives like this one. So I'm really grateful to Gabby and the SVP work group for making that connection initially for me and asking me to start. I started joining the SVP group meetings a few months ago, and I immediately started to see where these Venn diagrams of all the great things that are going on in the community are overlapping the systemic approaches that need to happen to see some real change here. So I think what the work groups have done today has been really tremendous. And I hope that we've given Marty and Gabby any kind of like tie things up remarks from you all on how hopefully this was helpful.
Yeah, it was super helpful. You all have so many amazing ideas and perspectives, and just having the opportunity to talk to people working in different fields is really great. If this is a conversation that you're interested in continuing, or if any of these focus areas, you know, really like you felt really energized or motivated to engage in them, I'll put my email in the chat. We're always looking for people to join the conversations that we're having in our work groups and our subcommittees. And I would love to continue this conversation, you know, outside of this 90 minutes. And as Jill said, with the jobs work group, definitely recruiting for that as well, if anybody's interested.
All right, thanks. Thanks, Gabby. Thanks, Marty. Thanks, everybody, for doing some work today. Old school human services coalition style. That's probably the thing that I miss. I miss being in space with you, with everybody. Doing it virtual is good, but I really miss old school, like at the floor at the fairgrounds building, and doing breakout groups at tables. But this has been really great, and I love doing this kind of work with you all. This is where good work happens, I think, in the coalition. So in the few minutes we have left, I know there's a couple agency announcements that I want to give some time for. So I want to real quick see if Mark and Heather from the United Way of the Plains were able to. Oh, there's Heather.
Hi.
Yeah, I asked Heather and Mark with United Way of the Plains just to kind of do a little refresher on United Way 211, update your data and all that stuff, and any updates from our friends at United Way of the Plains.
Great. Well, hi, everyone. You know, it was at the fairgrounds last time I got to come and be a part of your group and meet a lot of you. So it's hi virtually. It would be nice to see you in person, just as Jill said, but it's good to touch base. So just a reminder that people can call 211 anytime, 24/7, to talk to somebody about the issues they're facing, and then we're going to connect them to community resources. I pulled a quick report in case you're curious. Last month, the top reasons people in Douglas County were calling us were utility assistance, rent assistance, looking for low-income subsidized rental housing, homeless shelters, and dental care. So those were the main reasons that people were calling us last month in August. And as Jill said, the way that you can help me the most is making sure your agency information is current and updated in our database. I reach out to all of my agencies every year, and at this point, everyone has received an email from me requesting updates, except for my very last batch. I kind of do it rolling through the months, and my last one that I will send will be the 1st of October. And I have about half of the agencies in Douglas County updated. So there are a few that have not responded to, I email 3 times, then I snail mail, and then I have a volunteer that helps me call. So if any of you are curious and you're wondering, I wonder if our agency is updated, shoot me an email at hpierce, HPIERCE, at unitedwayplains.org. I'll check on that for you and let you know.
Thanks, Heather. And I'll just say from, you know, the Douglas County perspective, we try to be as big a boosters of 211 as possible. I think that we have resource referrals. We have all sorts of lists that I know, like even our friends at the library do an amazing job of putting that out. But I think like I love to remind folks about 211, especially, you know, it's a resource that you can call and talk to a human being that's been trained to talk to people that are experiencing some sort of a crisis or an emergency, and they're looking for resources. And the team that Heather manages can be more successful if they have the most recent information for our community. Even though they're in Wichita, they're still here to help. And I want to make sure that we continue to make those connections for our community members that are looking for assistance. Thanks for joining, Heather.
Of course.
All right, and I know Kim wanted to do some announcements.
Yeah, thanks. As most of you are probably already aware, with the closure of Kennedy Elementary School to K through 5 students, the school board also voted to repurpose the building as an early childhood community center. A work group of cross-sector community stakeholders, early childhood stakeholders have been working over the summer to work on that plan. And one of the big aspects of the model that we're planning to implement is a family resource center. Family resource centers are proven models across the country to have a significant impact in increasing access to services and supports for families. And what we will be looking for are collaborative partners, organizations that are already doing the good work to work with us within that space and out of that space in terms of outreach to families with young children, particularly to better support them. So I'm going to be reaching out to organizations in Douglas County over the next couple of months, just asking for a little bit of your time to talk about how you're already serving those populations, as well as to brainstorm a little bit of how we might collaborate to improve getting those services to children and young families and getting them in the support network as early as possible to have the best outcomes. So don't be surprised to hear from me. And if you already have ideas and thoughts, feel free to reach out to me. I will put my email in the chat.
Any other announcements? Feel free to just unmute. Anybody? Okay. Well, our next meeting is on December 9th. I don't have any hot topics planned, but if you have an idea, if there's an initiative that your organization's working on that you would love to have a similar kind of have the breakout session or just time to have a presentation and have get some feedback from our coalition, please let me know if you've got some ideas. I don't have anything quite slated. A reminder to the group that the Human Services Coalition is the convening entity for the Anti-Poverty Community Health Plan. Our quarterly meeting is on September 22nd from 1 to 2:30 via Zoom. I hope you can join. If you can't, we will record it and send it out. But we'll have some really great updates on a little bit more information on all the hard work that Kim has been facilitating over this summer, which I think just is evidenced in the fact that, you know, what's actually happening in a space in our community. It's pretty tremendous. And
Jill,
then
Jill, I would love it if we could take some time at the next meeting, if you have an agenda to go over where we've been and where we're headed and get some input from this.
Yeah, way to jump right on it. Yes. Well, let's plan on that. And we'll do a little preview at the quarterly meeting. But yeah, for the December meeting, Kim, you'd like to do that? Cool. That's great. So yeah, we'll have the quarterly meeting. We'll update on early care, and then we'll update on the the decriminalization of poverty. A really great conversations happened at a city commission meeting earlier this week that I just gives me goosebumps to think that we've elevated the conversation to that level, and so much credit to that work group. I think the jobs group is really going to start get going here soon as well, more in earnest. And then some tremendous information I think is also developing with regard to some of our cross-cutting strategies as it relates to transportation and data dashboards, and some important survey work that I am excited to have share out on with our friends from the health department that will inform the anti-poverty plan and the work of the groups. So with that, I'm super grateful to everybody for getting together today. Great conversation. I appreciate you all so much. reach out to me if you have any questions following up from today. Bye all.